And welcome to our show. I'm Lana Kay, and we are targeting seniors again with helpful tips for enhancing and hopefully prolonging your life. A warm welcome to Leigh Wagner. Welcome to the program, Leigh.
Well, thank you for having me today.
Now, Leigh is the clinical director at BenchMark Physical Therapy. Her facility is located on US 42 near our Union Kroger. So Leigh, I'm so glad you're with us today because you have some very impressive credentials. Leigh has a doctorate in physical therapy. So Leigh, that is, you really went the extra mile. Why physical therapy and why delve that deep into it?
Well, I'm going to date myself. When I ended up going to school, you didn't have to get your doctorate. So
okay.
Today, you do have to get your doctorate to go become a physical therapist. I ended up going back to school to get my doctorate. I am that person that loves the perpetual learning, so if there's ever a chance for me to go back to school and learn about something, I'm probably going to go do it. I think you can always learn something new. It expands everything about you.
Yes.
There's so much to learn in this world. I mean, so that's why I ended up doing mine.
Right.
And I became a physical therapist because I had the unfortunate incident of blowing up my knee at probably 16 years old and spent a nice 9 months of rehab in a physical therapy department and ended up loving my physical therapists, and they made me fall in love with physical therapy.
So there you go.
Mm-hmm.
BenchMark is probably a state-of-the-art, I hope,
yes.
a physical therapy facility. So it offers many different techniques. So Leigh, what it says on your bio, it says we offer many approaches, manual therapy. But what is manual therapy exactly?
So manual therapy, instead of giving people just your typical exercises or doing balance training, we do hands-on approaches. So you can do cupping, and you can do myofascial release. You can do dry needling. You can do trigger points. So it's really getting in there, feeling the person, understanding what's wrong with their specific issue. It goes beyond what a typical athletic trainer can do, what a typical person in the gym who is a personal trainer can do. That's what sets us apart.
That is wonderful information and very state-of-the-art. And then, Leigh, as you're the director, are you trained in all of these modalities? Wow, that was a lot to take on.
But again, it's that love of learning. Like I said, I am actually getting my certification this month in dry needling, so it's a new service that we're offering at our clinic at Union. So that's another feather in my hat.
Another exciting.
Yes, exciting thing that we're going to be offering. Yes.
Okay, so Leigh, let's talk about, help us understand why it's never too late to begin, because we are talking to our seniors, and I know many of them get stuck. It's like, I'm old, I can't do it.
I know, and that's the biggest thing is no matter what your age is, it is never too late to create a healthy lifestyle. Because it's not just about adding years to your life, it's about adding life to your years. We are going to live longer. It is inevitable. I believe that in my lifespan, I'm going to live to be over 100, and I think that's slightly depressing to me. So in my world, I want to have the best 100 plus years of my life. So that is why I feel that we need to inspire people to get active, get moving, and live the best quality of their life.
No matter how long it is.
And no matter how long it is, exactly.
Right.
And so what I'm going to try to break up are some of these myths that people have about getting moving and getting active.
Okay, so do that.
Okay, so the first myth is there's no point to exercise. I'm getting old anyway. And there are plenty of reasons to get active. Regular physical activity helps you feel younger. It keeps you independent longer, so you don't have to require moving into an assisted living facility. You don't need people coming into your house to help you take care of yourself. It also lowers your risk for a variety of diseases, including Alzheimer's, dementia, heart disease, diabetes, certain types of cancers, high blood pressure, and even obesity.
I understand the high blood pressure, I understand the cardio part, but how does exercise, Alzheimer's is neurological brain.
Yeah.
So Leigh, how does that enhance, not getting that from our exercise?
Because you have to think and you're using your brain.
Okay, so as we do that, we're exercising our brain.
We are.
Okay, great.
And then another myth is exercise puts me at risk for falls. And actually that is the polar opposite of that. By exercising, you prevent the loss of bone mass. That also improves your balance, which then reduces your risk for falls. And the biggest thing, as we get older, you don't want to fall. Because if you fall, the fall down is that you fall, you break something, you end up at the hospital, you end up at the skilled nursing facility, and there's a big chance you don't get to go home. That
is so true. I have a friend in her 80s, and the doctor, she's doing great, but he said the one thing you want to not do is fall. Because I had a friend, Leigh, that just shook herself up. She didn't break anything, but she was older, and just the impact of the fall, she never was good again.
The same.
Although nothing broke. So we don't want to fall.
No.
Okay, Leigh, what else have we got?
Another myth is I'm too old to start exercising.
Yeah, I'm getting old anyway. What's the point?
And again, you're never too old to get moving, improve your health. Another crazy thing is that if you've never exercised before, you don't have the risk of developing injuries that people who have already been exercising have those risks. So, in other words, you have many miles on your clocks, so you need to keep moving, and then you can reap those rewards.
Leigh, Leigh sent me some literature on this, and the most surprising thing was older people benefit more from exercise than younger people.
That is true.
So Leigh, how is that?
I don't understand the theory behind it, but it's just the fact that,
maybe they don't need to benefit as much as we do.
The little things. It's the little things that we do that it's like I have to work harder to end up gaining muscle mass or gaining flexibility or getting the benefits. Okay. And in your case, it happens more naturally. I don't really.
Did you say in your case? This isn't going to go well from here on out. Just kidding, Leigh. No, I do. I mean, it was surprising though that older people benefit more.
They really do. It's amazing. With my patients, they do so well. It's I've never moved. I've never done any of this, and then they're like, oh, I can do this, and I'm increasing the weight so much faster than usually a patient that comes in and already has an exercise program and had an injury. So it's neat to see that in them too.
Okay, Leigh, would you have to be hurt to come and see you?
No.
Could you just come and say, I saw the show and I want to feel better. Leigh, help me.
We offer free screens, so you can always come in and check us out. 9 times out of 10, there's something underlying underneath. You can say, my elbow hurts, my back hurts. These are just old aches and pains. And then we can do those screens. We can see what's going on. We can get you into an exercise program, and then education as to what you can do outside of the physical therapy world to prevent those injuries from perpetuating, from getting worse. So that's where we come in. I see patients that they come in because they're the fear of falling. I want to see you because I don't want to fall.
Right.
And then we can treat you for that and then prevent that fall.
Mm-hmm. To strengthen you.
Yeah,
so you don't necessarily have to be hurt. You don't have to fall. You don't have to have an injury. We could just come in and say, Leigh, this is hurting. Help me.
Right. Exactly.
Great, Leigh. What else have we got?
Another myth is I can't exercise. I'm disabled. So people who are in wheelchairs, yes, they can exercise. You can lift weights. You can stretch. You can do chair aerobics. You can do chair yoga. You can do chair tai chi. All to improve your range of motion all to improve your muscle tone, all to improve your flexibility, and this all promotes your cardiovascular health. So that is a thing.
You might even get up out of that chair.
Yes, I was going to say you're not limited, and that's what we always want to say. And I always say, like, watch the people on the Paralympics. They're amazing.
Yeah, true, they sure are.
And then myth number 5 is I'm too weak or I have too many aches and pains, which moving can help manage your pain and improve your strength and your self-confidence. The key is you start off gently. And the biggest thing is, and this is another thing, is if you have chronic pain, physical therapy is actually a great way for us to educate you in how to manage your chronic pains. So again, like how to get yourself moving again and get yourself back into active lifestyle, because it's kind of that fine line. If I don't move, I'm going to hurt more. If I move too much, I'm going to hurt more. Mm-hmm. So finding that happy median, and that's usually where a therapist comes in with that education.
Right. We want to start slow.
Yes.
And with your therapist, she will know how to balance this. You know, you don't, because so many people, if they jump in there, okay, I'm going to try, and they overdo it, then that discourages them.
Then you see me anyhow.
Right. And it discourages them. That really hurt me. I'm not going to do that anymore.
Right.
And so there's where she could really lead you.
Exactly. So what are the benefits of being physically active? So there's physical benefits. You can maintain or you can lose weight, which we all usually want. You could, by increasing your metabolism, building your muscle mass, burning more calories. It enhances your mobility, your flexibility, your balance, your strength, which all reduce your risk for falls. And this is very important in the prevention of arthritis, because the biggest thing is anyone over the age of 60 has arthritis. And so again, you want to manage that arthritis so that you don't have to have any joint replacements. You can stay mobile and active and prevent those falls.
And that means moving those joints, isn't it? Putting some, what do you call them, moisture, some lubrication back into them. So we do, even wrist, or, I know that. Everywhere. Keep it moving.
Keep it moving, and the right amount, like I said, that happy median.
Yes.
Also physical benefits, it lowers your blood pressure, it increases your bone density, decreases your risk for obesity, osteoporosis, that Alzheimer's, and heart disease.
That is unbelievable. That is such great information, and it inspires you.
Yes. And then reduces your risk for chronic diseases such as that heart disease, obesity again, and that colon cancer. So again, those cancers that can creep in, exercise helps prevent those things for you. Mm-hmm. And then there's also that mental health benefit of exercising. It actually helps improve your sleep. And I know a lot of us don't sleep or have to take sleep medications to sleep. And so then you can sleep better. You don't have to take those medications. I think we all don't want to take medications.
No.
It improves your individual independence. Again, we want to stay independent. We don't want to be having to rely on
someone else, on anyone else.
Exactly. And then it boosts your mood and self-confidence by releasing those endorphins into your body, which helps relieve the stress and the anxiety. So again, if you have a lot of stress and anxiety, you might be on those medications. I'm not saying it can make you come off of those medications, but I can tell you that it does help with it.
Maybe we could reduce
it. I can tell you that at the end of the day, when I've had a very long day, my favorite thing to do is to get on my treadmill and just walk, and that's my stress relief.
Exactly.
It really is.
Movement.
Yes.
Movement.
It really, that's why, you have to find what helps you get your stress relief.
And what you'll keep doing, and what you enjoy. Like you say, this is my thing, I know it is, and then you enjoy, you look forward to it because I'm going to feel better.
Exactly. And then the social benefits of it, by staying physically active, you often have a healthier social life, which involves regular interactions and that mental stimulation. I don't know how many people that I see are like, I retired, I'm at home all day,
I'm lonely.
I'm lonely. And then they end up with an injury, so then they come see me, so then they really love coming to see me. And
because there's people there. There's people there, and you're there.
Yes.
And there's, you know, they're not alone.
Right. So it's the social benefits of it. And I think that's the biggest reason why I think you go to it. And it's the reason why my mom goes to work out, because she's retired too and has nothing else to do. And you meet people your age. Right.
It's a great thing.
So like after her.
Especially if you were alone.
Yeah, I was going to say after her class, they go to lunch. I mean,
yeah, they've made buddies.
It's a very social interaction. And again, like it stimulates your brain. It keeps you mentally sharp.
Great.
And also the
Great
other thing is it does reduce your healthcare costs. There is a 100% correlation between exercise and the reduction of how much you have to spend on your healthcare costs.
Right there's incentive.
Right.
And I know how much that all costs.
Insanity. So again, by helping yourself a little bit, you can help yourself a lot.
A lot. Greatly.
And then how do you build a good exercise program? There's 4 areas that you usually want to have into your exercise program. Balance, which maintains your standing and stability, and activities like yoga, tai chi, dance, and posture exercises help with those. And it improves your balance, which correlates to improved posture, quality of walking, reduced risk for falls. As you saw her just sit right back up tall.
When she said posture.
And then your cardio activities, they get your heart rate pumping. You usually are like breathing, your breathing is intensified. These activities are your walking, your stair climbing, your swimming, your hiking, your cycling, your rowing, your tennis, your dancing. And these activities help lessen your fatigue, your shortness of breath when you're doing like your regular activities around the house, like pushing the vacuum cleaner, like carrying the laundry basket up the stairs.
The groceries.
And it promotes your independence, so you maintain that independence with everything.
Which is paramount.
Yes. And then strength or power training. So with the strength components, this builds your muscle with repetitive motion. You can use weights or external resistance machines. You can use TheraBand. You can use free weights. And the power training is where you do the training, but it's at a faster speed. And with those, it's good to prevent that bone loss, build that muscle, and improve your balance to avoid falls.
Whoa, that is great.
And again, these makes you independent for your day-to-day activities. So things like opening up a jar, getting in and out of the car, getting up and down from a chair, become easier because you have the strength.
Now to do those things.
Yeah, I was going to say the biggest thing I hear from people, it's like it gets harder and harder to get up from a chair. So again, that's your strength component.
And that's if they came and told you that, then I'm sure you would know where to start working.
What muscles we're going to be focused on.
That's
yes,
right.
absolutely.
They were starting to run short on time. I want to ask you, what's our most important thing that you want our viewers to think about, our seniors?
When you want
myself not included.
When you start off with any program, what you want to do is get with your doctor first. Make sure that he clears everything. Make sure that you're safe to start that exercise program. You want to consider your health concerns before you, again, go into any exercise program. So if you're a diabetic, you might want to stagger your program into adjusting the time of your medications or your meals. And the other thing too is you can always, if you're not sure where to start after you talk to your doctor, you can always like come to a physical therapist, because again, we can usually structure it with like, most people have an ache or a pain, or they have a balance concern. We can go from that free screening, we can get you into doing therapy, and then we can create you with a home exercise program and then educate you on where to go after we're finished, if it's with a program in the home, if it's going to like a facility after the fact, and that way you stay active, you stay motivated, and we like to, at BenchMark, we like to check in on you. So we'll be checking in on you anytime. So that's really what I like to say to people is like, keeping you motivated and keeping you going. It's 2020, and
that's great, Leigh.
Here's your New Year's resolution.
Thank you for all this valuable
Absolutely.
information. We've learned so much from her today in so little time. So you've been listening to Leigh Wagner, Clinical Director, BenchMark Physical Therapy. Leigh's contact information will follow. And as Leigh said earlier, it's never too late to make these changes, and we just don't want to live long. We want to feel as good as we possibly can as we make the journey. So until next time, you be happy and you keep smiling, and I'll see you soon.